Hi, I'm Katie Beyer. I am a pelvic floor PT with Concierge Physical Therapists, where we treat in-home or in office. And so we bring our table and our supplies and everything we need, and we come to you wherever you might be. And today I want to talk about what a pelvic floor PT session actually encompasses. I think oftentimes people are referred to pelvic floor PT and they don't really know what they're getting into, or they may find that they've diagnosed themselves on the internet and send themselves to pelvic floor PT, but then aren't really sure what to expect in that first session. So that's what I'm going to talk about. So a session starts really like any other PT session. We get a really good history, including what brings you to therapy, what your current symptoms are, what your past issues may have been, past injuries, surgeries, anything that kind of has brought you up to this point. And then we'll get into things more like bowel and bladder, such as maybe frequency, urgency, what your poop looks like. Are you able to hold your pee in your poop? And then maybe a little bit more into your diet, depending on how those areas look. And if you're postpartum, we will definitely get into your pregnancies, your deliveries, whether it was C-section, vaginal, how long did you push for? Were there any instruments like forceps used? Any issues during the pregnancy? Were there any issues in the weeks or months after pregnancy? And then it doesn't matter if it was, a couple months ago, was it years ago? You're still postpartum, and all that information is very important to us. And then some about your sexual history and about your current ability to have intercourse or perform any other sexual activities that you'd like to. So if you have pain with sex, when do you have pain during sex? Do you have to have certain positions? Is it sharp pain? Is it dull pain? All of these things really matter as far as kind of what is the cause of it. And all of that stuff, the bowel, the bladder, the pregnancy, the sexual history is important because it helps us kind of get this big picture of what we're looking at and to help us diagnose and then treat effectively. And then we need to know what your goals are, because a woman who comes to us with urinary incontinence, which is the inability to hold her urine, if you want to get back to doing a marathon, that's a very different strategy than somebody maybe who wants to get back to simply coughing or picking up their child without peeing. So we would have to kind of modify our treatments and modify our goals according to the patient. So the actual physical assessment in the beginning, again, starts out kind of like a regular PT session. You would stand, you would lie down, move around. We look at posture, how you breathe, how is your strength, range of motion, and things like that that kind of would happen in an everyday PT session. And then we get into the internal stuff where we obviously make a little bit of a switch. So why do we have to go internal? And what does that mean? Well, this is your pelvic floor. This is kind of the bottom part. It's the front. I'm looking at the inside. These muscles are a portion of your pelvic floor, and we can't get to these muscles without going internally. And so we either get there via the vaginal hole or the anal opening. And so that's why that we have to do the internal work, because we simply can't get to many of these muscles without doing so. So what does that look like as far as a treatment? With Concierge, we're in your home and we have the table, so we have clean sheets we bring, and we would put those on the table, and kind of like a pap smear appointment at your OBGYN, we would leave the room, you take off your pants and underwear, and you get on the table, and then we would come back in, put on clean gloves, and start the assessment. And initially, it's really just observation. This is kind of the view we have when we first start. And so we're just watching to look how you contract, how you relax, how you may bulge. What do the tissues look like? Do they look healthy? Is there any redness? Are you healed well, maybe after any kind of surgeries? So we kind of just do a very general observation at first. And then externally, we start palpating the muscles here. These muscles are all a part of the pelvic floor and important to its function. Does any of this hurt you? Do we feel any tension? Do we feel any tightness or trigger points? And if you have any pain with sex, if you are unable to have sex, or if you're unable to put in a tampon, that might be where your exam ends. So we will not go internal if your body can't handle it. And that really goes with any patient. If the first session you're not on board with going internal, if at any point during the therapy you decide not to do it that day, or in the middle of an internal exam or internal treatment, you've just, you've had it, you verbalize that to the PT and it's over. So you're always in control. The ball is always in your court, and there's always a lot of communication between the therapist and the patient. So if you have a lot of pelvic pain and this is where you end, then that's where it ends. And you simply are trying to be able to get to a point where internal is possible. If pain isn't your issue and you're there for other things, at this point we would go internally and try to assess these muscles in here. How does it feel to you? Is there pain? When we feel it, do we feel any tightness? Do we feel trigger points? Do we feel an area that feels really too lax or too loose or too tight? So we do a general assessment like we would to any other muscle group. And then we also look at strength. So we have you do a contraction, and the best way to really feel that contraction is to be within the muscle. So we feel for that squeeze and we can rate it and decide how strong you are. Some PTs also use a biofeedback tool to read, that kind of get a mathematical reading of your strength as well. So either is totally appropriate. So that's basically the exam of kind of the external pelvic floor and the internal pelvic floor. That is not all encompassing, but that gives you an idea of what our approach is. So after we do the internal assessment and the kind of more general external assessment of your body, we come up with a plan and we go from there. And treatments often include both the internal and external, and exercises and things like that. So that's the basics of a pelvic floor PT exam. In a very similar way, the treatments will kind of be, will be very, very much like that. So I hope that helps you understand what we do and why we do it. And good luck to you in all your PT endeavors.